Our topic for today is nursing process in pharmacology. The nursing process is a conceptual framework that nurses employ to guide the healthcare delivery. In this section, we will consider how the nursing process can be applied in drug therapy. The nursing process can be viewed as a cyclic procedure that has five basic steps. First is the assessment. Second is the analysis, including the nursing diagnosis. Third is planning. Fourth is implementation. And lastly, evaluation. Assessment consists of collecting data about the patient, while analysis or nursing diagnosis, the nurse analyzes the information in the database to determine the actual and potential health problems. These problems may be physiologic, psychologic, or sociologic, and in planning step, these problems are delineated into specific interventions directed at solving or preventing the problems identified in analysis. In implementation, these steps begins with carrying out the interventions identified during planning. Some interventions are collaborative, while others are independent. Then lastly, evaluation is performed to determine the degree to which treatment has succeeded. In discussing the applications of pharmacology in patient care, we focus on these 8 aspects of drug therapy as shown in this slide. In pre-administration assessment, we have 3 basic goals: collecting baseline data, identifying high-risk patients, and assessing the patient's capacity for self-care. The first 2 goals are highly specific for each drug. Accordingly, we cannot achieve these goals without understanding the basics of pharmacology, while the third goal applies generally to all drugs. In the first goal, we collect baseline data because baseline data are needed to evaluate both therapeutic and adverse drug responses. In the second goal, identifying high-risk patients, the important predisposing factors are the pathophysiology, especially the liver and kidney impairment, genetic factors, drug allergies, and lifespan considerations such as pregnancy or the very young or those with advanced age. Next would be the dosage and administration. Certain drugs have more than one indication, and dosage may differ depending on which indication the drug is used for. Aspirin, for example, is given in low dose to, to relieve pain, and in high doses to suppress inflammation. Many drugs can be administered by more than one route, and dosage may differ depending upon the route selected. Example will be morphine, which can be given by mouth or by injection. And certain intravenous agents can cause severe local injury if the drug extravasates. Example would be your vancomycin. Third will be promoting therapeutic effects. Drug therapy can often be enhanced by nonpharmacologic measures. Example of this will be enhancing drug therapy of asthma through breathing exercises, biofeedback, and emotional support. Other example would be enhancing drug therapy of arthritis through exercise, physical therapy, and rest. And third, enhancing drug therapy of hypertension through weight reduction, smoking cessation, and sodium restriction. Next would be minimizing adverse effects. All drugs have the potential to produce undesired effects. Common examples include gastric erosion caused by aspirin, sedation caused by antihistamines, and hypoglycemia caused by insulin. To help reduce these adverse effects, the nurse must know the following about the drugs to administer. First is the major adverse effects the drug can produce, when these reactions are likely to occur, early signs that an adverse reaction is developing, and interventions that can minimize discomfort and harm to the patient. Next will be minimizing adverse interactions. So when a patient is taking two or more drugs, those drugs may interact with one another to diminish therapeutic effects or intensify the adverse effects. For example, the ability of oral contraceptives to protect against pregnancy can be reduced by concurrent therapy with carbamazepine, and the risk of thromboembolism from oral contraceptives can be increased by smoking cigarettes. So, how do we minimize the adverse interactions? First, we take a thorough drug history. Then we advise our patient to avoid over-the-counter drugs that can interact with the prescribed medication. Then we monitor for adverse interactions known to occur between the drugs the patient is taking. And we should be alert for the possibility of as yet unknown interactions. Next would be making PRN decisions. PRN stands for pro re nata, a Latin phrase meaning as needed. So a PRN decision is a medication order in which the nurse has discretion regarding when to give the drug and in some situations how much drug to give. So in making PRN decisions, the nurse should know the reason the drug is prescribed and be able to assess the patient's medication needs. Example would be a PRN order of diazepam as needed for active seizures. Next would be evaluating responses to medication. Evaluation is one of the most important aspects of drug therapy. After all, it is the process that tells the practitioner whether a drug is producing a benefit or is causing harm. Because nurses follows the patient's status most closely, the nurse is in the best position to evaluate therapeutic responses. So when evaluating responses to a drug that has more than one application, the nurse should know the specific indication for which the drug is being used. So nurses should know the rationale for treatment and the nature and time and the course of the intended response. Example may be giving nifedipine, which is used for both hypertension and angina pectoris. So when the drug is used for hypertension, the nurse should monitor for the reduction of blood pressure. And if the drug is used for angina, then the nurse should monitor for reduction of chest pain. So clearly, the nurse should make a proper evaluation by understanding the reason for the drug use. And lastly, managing toxicity. Some adverse drug reactions are extremely dangerous. If toxicity is not diagnosed early and responded to quickly, irreversible injury or death to our patient can result. So to minimize harm, the nurse should know the early signs of toxicity and the procedures for toxicity management. Thank you.